Good day guys, we have been discussing about the arterial supply of the lower limb. So we already discussed about the femoral artery, popliteal artery and its branches. Now we'll discuss about the anterior tibial artery and the posterior tibial artery and its branches. So we'll come to the anterior tibial artery. So as we discussed already, the anterior tibial artery arises from the posterior popliteal artery. So this is the popliteal artery. So as you already know, the popliteal artery actually runs through the posterior side of the lower limb. So the popliteal artery gives rise to the anterior tibial artery by running in between tibia and fibula through the superior aspect of the interosseous membrane. So this is the popliteal artery. So it runs anteriorly through the superior aspect of interosseous membrane, and this is where you find the interosseous membrane. So we learn about the branches of the anterior tibial artery. So the anterior tibial artery, just before it passes through the interosseous membrane, it gives rise to a branch called as the So it gives a branch called as the posterior tibial recurrent artery. So just before the anterior tibial artery passes through the interosseous membrane, it gives rise to posterior tibial recurrent artery. And after it passes through the interosseous membrane, it gives out a branch called as anterior tibial recurrent artery. So the first branch is posterior tibial recurrent artery and the second branch is anterior tibial recurrent artery, and it also gives out numerous muscular branches. So it gives out muscular branches. So the anterior tibial artery, just in front of the lower extremity of the tibia, it gives out two branches. Which is called as the anterior medial malleolar artery and anterior lateral malleolar artery. Then the anterior tibial artery gives rise to the dorsalis pedis artery. So this is the dorsalis pedis artery. So there is something peculiar about this dorsalis pedis artery. This is where you palpate the pulse. After the pulse is palpated laterally, so the pulse is laterally to the EHL tendon. EHL tendon is nothing but the extensor hallucis longus. This is where you palpate the pulse. So this dorsalis pedis artery gives rise to two branches, which is lateral tarsal artery and the medial tarsal artery. So the dorsalis pedis artery gives out the branches called as the lateral tarsal artery, the medial tarsal artery, and it gives rise to another branch which is called as the arcuate artery. So this is called as the arcuate artery. So in the end, the dorsalis pedis artery gives out two branches. The first branch is first dorsal metatarsal artery. So the first branch here is first dorsal metatarsal artery, and it also gives deep plantar artery. So the dorsalis pedis artery gives rise to lateral tarsal artery, medial tarsal artery, arcuate artery, and the continuation of dorsalis pedis artery at the proximal end of the tarsal. So the dorsalis pedis artery gives out two branches, which is at the end of first tarsal metatarsal space. In between the first tarsal metatarsal space, it gives out two branches, which is the deep plantar artery as well as the first dorsal metatarsal artery. And the second, third, and fourth. The second, third, and fourth dorsal metatarsal artery arises from the arcuate artery. So the first dorsal metatarsal artery arises from the dorsalis pedis, but the second, third, and fourth dorsal metatarsal artery arises from the arcuate artery. And also it gives out many perforating branches, posterior perforating branches from the plantar arch. So I guess we're done about the anterior tibial artery. So we'll have a quick summary about the anterior tibial artery and its branches. So the anterior tibial artery arises from the popliteal artery, and it runs between tibia and fibula anteriorly, and it ends as dorsalis pedis artery. So the anterior tibial artery, before it passes the intraosseous membrane, it gives out a branch called as the posterior tibial recurrent artery. After it passes through the intraosseous membrane, it gives out a branch called as the anterior tibial recurrent artery, and it gives out many numerous muscular branches. And in front of the lower extremity of the tibia, the anterior tibial artery gives out two branches, which is the anterior medial malleolar artery as well as anterior lateral medullary artery, and it gives rise to dorsalis pedis artery. The peculiarity about the dorsalis pedis artery is that you palpate the pulse laterally to the extensor hallucis longus tendon. So the dorsalis pedis artery gives out branches called as the lateral tarsal artery, the medial tarsal artery, as well as the arcuate artery against the tarsal metatarsal joints, the metatarsal joint. So the continuation of the dorsalis pedis artery is two small branches, which is the deep plantar artery as well as first metatarsal artery, dorsal metatarsal artery. So the second, third, and fourth dorsal metatarsal artery arises from the arcuate artery, and also it gives out many perforating branches whose origin is from the deep plantar arch. So in the end, the dorsal metatarsal arteries gives out many dorsal digital arteries to supply the digits. So I hope you're clear about the anterior tibial artery and its branches. We'll give you a heads up on the next artery, which is the posterior tibial artery. Thank you so much for your time. Have a great day.